My name is Valid Ghafoor. I'm an FY2, which makes me a junior doctor. It means it's my second year out of medical school. I'm due to finish my foundation training very soon. A junior doctor's lifestyle is actually very, very different to what I thought it would be. I sort of imagined it being what you see on TV, sort of running around, crash calls, people incredibly sick everywhere. And although you do see that occasionally when you're on call and you're quite short-staffed, the most of the time, on a Monday to Friday, on a 9-to-5 job, the job of the junior doctor is to, I think the best way to probably put it is to act like a glue of sorts. So you have your seniors, your consultants that will make decisions, that will do ward rounds, that will give their expert opinions and put plans in place. And then you'll have your slightly more senior doctors that will come around and help if there's anything you're struggling with. But for the most part, your job is to make sure that patients are happy, that jobs are done. If a scan has been requested, you need to make sure that scan happens. If it doesn't happen, why isn't it happening? What's the hold up? And sort of the general maintenance of the ward, so making sure patients aren't getting dehydrated, making sure medication charts don't run out, making sure discharge paperwork is done on time so patients aren't delayed in leaving hospital. And although these jobs might seem sort of not what you expect for a doctor, the reality is if somebody doesn't leave hospital, that's a day less they have to spend with their family. That's a day more that increases their chance of picking up an infection in hospital. And a lot of that falls on us really. So we're sort of the people that help the consultants and the nurses in between and sort of make everything work.
Hi, I'm Hannah. I'm a junior doctor doing anaesthetics. I'm a CT1 trainee, currently working at Preston at the moment. Junior doctors can be anyone from foundation year up to quite a senior level. I'm an anaesthetist or an anaesthetic trainee. I'm quite a junior trainee at the moment. I'll start my day by pre-opping patients for their operation. I'll then go down and prepare the drugs for their operation and talk to the theatre team. We'll decide what order the patients need to be in for the operations for the day and speak to the surgeons. Working with a senior consultant, we'll then provide the patient with an anaesthetic and look after them during their operations. I also do emergency operations during the night and during the weekend. If there's anyone who is very sick and if their heart stops beating, we would be on the team that helps with their breathing or goes to A&E and helps with their breathing for CPR. We provide help with the intensive care unit and also with obstetric anaesthetics of doing that. It's quite a wide-ranging service as a junior doctor. That's why it's interesting.
So I am currently working as a junior registrar in neurosurgery. After medical school, I worked for 2 years as part of the sort of compulsory foundation programme. Currently my working week is split between research and the hospital, and in the days in which I'm based in the hospital, our days normally start at 8 o'clock in the morning, where we have a handover meeting, and in that handover meeting we discuss all the sort of cases that have been referred to the neurosurgical service in the hospital overnight. And after that meeting where we discuss the cases and make a plan for them, then we spend some time going to see the patients that have been admitted overnight. During this time I am sort of taking referrals from all over Greater Manchester for any patient who has a neurosurgical problem, and occasionally some of these patients we have to bring across into our hospital and maybe do an emergency operation on. I always have my senior colleague there to sort of help out with these things. The hours can be long, the sort of average on-call day can be from sort of 12 to 14 hours, but it's very rewarding. And even though, at the end of these sort of shifts, I feel tired, but at the same time I feel like I've made a difference, and a good difference in the lives of the people I've met and the patients I've come across, and I really wouldn't trade that for anything.